Hi, my name is Tosh Bean, and welcome to another episode of welcome to Digital Health on Air. Excuse me. It's getting, my caffeine is starting to wear off. Today, we have the privilege to be joined by Rob Bailey and Kurt Ackerman, both of whom work at Tandem Health. And I'm really excited here because I think we have two folks who have a lot of expertise on really driving patient experience and modernizing the consumer or patient experience. So I'd like to really start off by maybe they could just introduce a little bit about what Tandem Health is about, and a little bit about their backgrounds. And then we can start jumping into some of the juicy topics about how they've been really on the forefront of pushing patient engagement and really keeping up with other industries as they are pushing the envelope on patient self-serve and being able to be helping the patient meet the patient where they expect to be met.
Mm-hmm. Yeah, absolutely. Rob, I'll go first if you don't mind. I'm Kurt Ackerman. I'm Vice President of Business Development here at Tandem Health. Tandem Health is a federally qualified health center that's located in Sumter, South Carolina. Been in existence a little over 20 years, so it's certainly has a long-standing presence here within our local community. My background actually clinically is sports medicine, athletic training, rehab. I got spilt over through a series of odd events into business development that largely came through my years of running occupational medicine. And so did almost 20 years in the hospital system, and I've been here at Tandem for 6 years.
Well, I'm Rob Bailey. I'm the Chief Population Health Officer here at Tandem Health. I've been with Tandem just shy of 2 years. I, like Kurt, have come from the large health system background. This is my first federally qualified health center, community health center, work that I've been doing. I come from academic medicine, particularly in the cardiology world. So this has been quite the change in terms of how we engage our patients. But we brought a lot of lessons over from what we've learned in the acute and the large health system world to be able to apply here. And I think we're kind of onto something, and hopefully we can able to generate some success in the future.
Perfect, great. So the first thing I'd really love to dig into, and I would encourage all our listeners actually while they're listening to this, to actually check out Tandem Healthcare's website. There's a few Tandems, so this is the one that's based in South Carolina. Yes. But I think what's obvious if you go to the website is that it's a very modern experience. It's very clean, and I'd love to be able to understand some of the inspiration. How, generally when I've gone to other healthcare systems and S2E8 websites, it can be somewhat of a daunting task to figure out what I want to be able to accomplish. And so I'd love to be able to hear, for me and for all the listeners, describe the process of how you designed the website, how you wanted to really push the envelope on making it a truly modernized consumer and patient experience.
Absolutely. Well, I would love to take credit, as an administrative team for the entire concept. But back in 2018, Sumter Family Health Center rebranded into Tandem Health. So Tandem Health used to be Sumter Family Health Center. In that rebrand was an overhaul of just about everything that the organization operated. And the window into the operation is the website. That's just the way people operate nowadays. So in that process of evaluating our website, we worked closely with consultants who, to my knowledge, did not do a lot of healthcare. They were very consumer driven, and really they kept pulling the reins back on us in terms of forcing simplicity. We'll think about, because our natural tendency is to say, well, we want to paint the biggest and the brightest and the most active portrait possible because we want to stand out. We want to pop. We want to do all these things. But from a consumer and a customer and a patient standpoint, it's one of two, typically speaking, one of two sorts. One is people are looking for one specific thing, and they may dive off and, go down a rabbit hole as they're looking for that one particular thing. They're looking for a family medicine provider. They're looking for a pediatrician, that sort of thing. Or you get the other sort where they're just wanting to surf. They want to go through the whole website. They want to look at all sorts of things. But we needed to make it easy on the eye and the brain when they clicked on the website. Up at the top, they can see everything from, not to overstate it, but, they could see our service lines, our locations, how to, what we've got going on in terms of community activities. It's not a lot. It's just not a lot. And what we have found is, and I appreciate the compliments, we have found that to be generally the feedback that we get. They're like, I appreciate, how easy it is to enter into that website, and it doesn't lead me, it doesn't force me into a rabbit hole if I don't want to go there. So there was a lot of, even down to the font, things, again, my background is, rehabbing shoulders and, that sort of thing. I never gave a second's worth of thought to what kind of font we should be using, and look at this color scheme. And, but it plays a role. And one of my responsibilities here is marketing and development. And in that process, you have to pay attention to what everybody is hearing, what they're seeing, and how they're receiving what we're saying. And so it's all part of it's really, simply put, it's part of the game.
Yeah, no, great. And, I'd be interested in digging further. So how did you decide? And Rob, I'd love to hear your comments about this too. Sorry, did you want, I have another related question if I'm just going to run with it, if that's okay.
Yep.
Like, how did you decide what to put on the website? Like, so, oftentimes they talk about, like, when a patient calls into the call center, there's like 3 different things that they always, like 95% of their concerns kind of fall into one of the 3 buckets.
Mm-hmm.
And I imagine that's kind of the same experience patients are having when they're doing a website. So I'd love to be able to hear, like, how did you decide, like, hey, like, this is something we should have on the website, and this is like just not needed?
Yep. Yeah. As Kurt mentioned, as part of the rebrand, it was very informational, they're very information heavy. And one of the things that we realized, to your point, was that when patients or consumers are trying to look for information regarding to your health center or a particular health entity, it's usually action oriented. They want to accomplish something, and they're not necessarily there to learn or to be educated about specific health topics. So those topics or those actions are what we wanted to land on. The first thing was, if you're familiar with Tandem Health and you're an existing patient, the most common thing was patients wanted to schedule an appointment. That's what they wanted to do. They land on your website, they think, this, or they're using the Google feature to be able to get to a specific spot on your website, and maybe not even landing on your homepage. You may be landing somewhere a little bit deeper, but to be able to have that action capability from anywhere. So scheduling an appointment, it was number one. The second component, which we're working on currently, has to do with pharmacy interaction and being able to refill prescriptions. So people are looking for an automated way or a very simple way to fulfill that need. And the last component was, Kurt kind of touched on it, when you're looking for a primary care provider or even another provider, you want to kind of learn about them quickly and then being able to do something about it, whether it be to chat with someone, to be able to get some quick information, or even to circle back to that scheduling component. So that's kind of where we're looking and have been looking in terms of how that is designed.
Yeah, that totally makes sense. We've heard this from other organizations we've worked with, and it's interesting because they talk about it. They say, okay, the 3 main reasons people call into call centers is for a scheduling purpose, which you've actually obviously addressed, medication refill, and then the last one is like getting a diagnostic lab result. And it's remarkable to me that websites actually don't make it easy. They actually don't simplify those tasks, and in fact, they probably spend a lot of time focusing on other things that may be important for some patients, but if you're talking about hitting low-hanging fruit and just creating an ultimate experience, I mean, it just, totally makes sense what you guys have done. And in fact, actually kind of is very reminiscent to when Amazon first introduced that one-click kind of buy thing, like, it's just like, just like, what the consumer wants, what the patient wants, why not just help them get to that much faster? So, I mean, I think kudos to you guys on designing something that just is very modern and just is very, like, very refreshing, to tell you the truth, kind of in the landscape of the healthcare space. I'd love to be able to shift gears a little bit now. And you and talk a little bit about appointment utilization and how you've tried to improve the experience both from an operational side for your team and for the patient in terms of making available last second appointments, or making a kind of helping match that supply and demand of last second appointments being available, and then that demand that patients have trying to get in sooner. And it can explain like where the genesis of the problem, how you kind of started approaching it, and then some of the downstream results of that.
Sure. I'll start, Kurt, if that's okay. The genesis of all this came mainly from, we started looking at really population health specific kind of data, and really quickly realized that access was a really big obstacle and key component. So we weren't going to get to closing all these gaps and things like that until we were more accessible. And then the actual root of that access came looking at thinking, man, as I look at our appointment data, we're doing a good job of utilizing the appointment schedule, basically from a scheduling standpoint, but not doing a great job of actually transitioning those appointments or those scheduled appointments into completed visits. And started really kind of digging into what we needed to realize that we had a very unilateral relationships with our patients via communication. So they either had to call us or they could send a message via the system we were using at the time. It required a lot of heavy lifting on our staff to kind of get to that information, and then to make actually an action on the schedule, to basically go in and cancel the visit. They actually had to go in and do something. So which left us with this lack of flexibility within our schedule when patients would call in and cancel last minute. Sometimes that wouldn't even be recognized till the day of or even later in the day. And there was no ability really with our staff to be able to utilize that appointment. So we really took a lot of focus, and particularly with the Luma capabilities of being take advantage of that bi-directional relationship where those appointments could be generated, they could be canceled and rescheduled, but mainly that it could be visible in real time to our patients. And we have staff now that eyeball that schedule and really keep an eye on that. So if slots open up, they can work wait lists. They have patients that are calling in that have acute needs that can be placed and really improve that utilization component of our schedule.
Perfect. So, in kind of just digging further into that, it's interesting to me, kind of the first part of our conversation was about like the web experience, and kind of meeting the consumer where they are, which is they're surfing the web, trying to get what they want to be able to do. But I think this really underlies an important experience part of the patient, is that they're not always on the web. They may be living somewhere else. Not all patients find their way to the web, and so it's interesting, like to be here. What was the thought process about empowering the patient in this process? So just an underlying, of course, is that the way that you are engaging these patients are kind of meeting them where they are, which is in the text messaging channel.
Yeah, no, I think it starts with, thinking about healthcare being consumer driven. I think at least in my history, it's one of the things where healthcare has been kind of separate from that normal consumer driven market, but it's not anymore. And that ability to really understand what not only patients want, but maybe expect now in their experience. And, probably within, I'm going to say within 5 years, but definitely within the last 10 years, the way we interact with various components has completely changed. And our expectations of being able to manage our lives via some sort of digital component have things. So we have to adopt that. That was something we knew we had to include within our offerings. Life's complicated. It's not getting simpler. We want to be flexible. When you mentioned about meeting patients where they are, that's where they are. Right? They know things are going to pop up, and we need to make sure that we have telehealth opportunities when patients can't make an in-person visit, or have the ability to chat with someone when they can't physically talk on the phone. And having those opportunities, and we've gotten some good feedback from our patients, thanking us for making sure we have those capabilities. But it also opens up the doors, as we begin to add features and components going down this digital path.
Great. Now, one thing as we've noticed is when we talk to clients and potential partners about doing something like this, one of the major pushbacks that we often get is from the operational side. Like they're always worried, how will this change what I have to do. And, the folks kind of just in the trenches were every day kind of on the phone and really working, patient facing. And so I would love to be able to understand, because what we have found is that oftentimes solutions make sense, but implementing them is where the real challenge or where the hurdles often show up. And so if you could really talk a little bit about some advice that you have in terms of getting buy-in from folks who were doing a lot of that work, because it still changes, even if it does indeed make their lives easier, it does change things they do. And, as Rob and Kurt, both of you are aware, changing human behavior software is easy. Changing human behavior is actually harder. And so I'd love some insight on what was your process in getting them on board and helping them be, owning the problem, be champions of trying to conquer this problem.
Rob, if I could dive in for a second, I think one of the first things is practicing, learning to practice honesty and humility in your operations. Being in healthcare now for so long, that is probably one of the hardest things for people to admit, is that operationally they ain't got it. So I've often said, delivering care, provider to patient, that is not the hardest thing we do. It is the most skilled thing we do. It is not the most difficult thing that we do. As a matter of fact, the grand majority of providers that I have worked around over the years, they all say, I just want to see patients. I just want to see patients. Well, guess what? Our customer base, they just want to see the doctor. But that's where our holes and our margin, hopefully that margin is shrinking, but that's where our margin of improvement has always, that's where it resides. It's never really been in the care. Whether I was at the hospital or I was here, you look at clinical quality measures and, well, our providers are doing pretty well, have always done really well, to be honest with you. But where people run into issues, they said, well, I can't get an appointment forever.
Yes.
But well, when we start digging into things, people say, well, we're booked out 6 months. Well, why are we booked out 6 months? So the thing that, we all had to realize here, and I would say this moving forward, people's expectation when they enter into a medical facility, whether it be inpatient or outpatient, they're not shocked when they see a provider. They're not shocked when they get a prescription, and they're not shocked. I mean, they shouldn't be shocked if they start feeling better, or there's some results. And certainly there are some things out there where that's not ever going to be the case, and we fully appreciate those things. But that's people's expectations. So when I hear people, when we get into meetings, that's sometimes we lean on that entirely too much. We go, well, we give good care. We give good care. Well, that's the expectation. That's not the exception. It's not. And so the differential is the entire experience. And that is from the phone call in, that is to the scheduling, that is to the cancellation, that's to the reschedule, it's all that. That is the differential. And, healthcare to me, that's an infinite game. You're never going to win the game. All you possibly can do is create this perpetual motion of patient experience. That's really what you got. You have to take all that into account and create ease for these folks that have chosen to use you.
I'm sorry. I was going to say, you hit the nail on the head when you said about implementing a software system is easy. And, so when we implemented the Luma solution to us, it quickly, in going down the implementation approach for us, it quickly highlighted the silos within our operational, in our operational areas, and finding that, one was related to that. And we think, hey, we're just going to be implementing a solution that sends out text messages and gives our patients lots of flexibility. But then you realize the dominoes start to fall and where everything gets implemented. So we had to put a lot of focus, and still do, in having a multidisciplinary team that sits and focuses on what solutions such as Luma and many others can do for us and how it impacts them. So we've had to make a lot of adjustments in the scheduling end and how schedulers are structured within the organization. And one of the things that came about was we realized, that we've become fragmented in the operations of house schedules. Like certain services wanted a very unique scheduling experience. And we took the tactic of realizing that no, kind of a standardized solution actually worked a lot better for us, and trying to get rid of a lot of those nuances because it presented complication to our patients. The more it worked great for us internally. Those nuances tend to work well for our staff and our providers. But looking outwardly, it did not work well for our patients. Having a very simple, standardized approach for our patients on the way in was impactful, and that has helped us kind of get those operations a little more seamless. To the point where we redid our phone tree, just to make sure that it mirrored the experience that you were looking at from a digital perspective, and to be able to get where you need to go, speaking the same language, using the same lingo. So that would be one advice I would give to others that are going down this path: is don't be afraid to look at your operations and understand where your silos exist, and don't be afraid to think about, standardizing the experience for your patient across the board.
Yeah, there's always going to be a ditch that you need to throw dirt in, and it doesn't matter how good you are. I mean, there's bumps and dips everywhere, but you have to be honest, about those things. So,
a lot of gems in that, starting from web experience to organizational changes to meeting where the patient is. So I want to challenge you guys. In what, if you want to leave one closing, one piece of advice for our listeners, and I can give you a few minutes if you need to think about it, but what is it that I think, if someone had to take one thing away from all your experience in terms of just focusing and optimizing the patient experience, but also in taking into account some of the organizational changes that you have to do to be able to optimize that, what would you say that would be? And I think just one piece of advice, if you can kind of let our listeners walk away with.
Yeah, I'll start. I would say, listen to your patients. They are telling you what they want. They are somehow, some way, through many different mechanisms, are giving you that feedback. And many times, probably not just specifically in healthcare, but I think we tend to look at the experience from the inside out, as I mentioned. I think we look at thinking what works best for our staff when we get into the operational components of, well, this economically makes sense for us, but really what it makes, and this is not just cliche saying that, that it's all about the patient, but they're your consumers and understand they have choices, and if we don't provide a seamless experience for them, there are choices that patients can make to go to other places. What you want them to be able to access your health center, but you also want them to see how well and what good service you provide. Don't be afraid to put information out there that patients, can look at it and kind of quickly understand the good work that you do. So I would say, don't be afraid to really listen to them and make adjustments accordingly.
Yeah, I think the connectivity to the patient in a way where you understand that they are your customer is invaluable. It seems simple, but they have chosen you, and in that choice, you have been given the blessing of an opportunity to serve them and their family in their most precious asset, and that is their health. It's probably the thing that occupies more of their brain power than anything. They, and when you think like that, I used to chuckle when they'd say, "Oh, the customer is always right." Well, that's debatable, but here's the deal in healthcare. The customer may not always be right, but they certainly are almost always more important than me and, any other thing that I've got going on. So if, again, I think that forces us to always scratch at what we're doing to see how it's impacting the patients and their experience.
Great, Rob. I'd really like to thank you. This has been, as a physician, this has been not only inspirational, but also as a digital health enthusiast. I mean, I think there's a lot of common blood that we share. And I'm sure that a lot of our listeners are going to really benefit from that. I really appreciate you taking your time, and look forward to doing this again. Thank you so much.
Absolutely.
Thank you.